Hi, my name is Dr. Sushila Kataria. I work as Head and Director, Department of Internal Medicine, Medanta, the Medicity. Today we are going to know about malaria, its causes, its treatment and what complications it can cause. So malaria is an infection. It is a protozoal infection which is also called, it's a vector-borne disease caused by bite of Anopheles mosquito, especially the female Anopheles mosquito who are infested with the protozoa which is called the Plasmodium protozoa, which is the causative organism for this infection. It leads to fever and lot of other complications. So malaria is a vector-borne disease which can cause fever to start with. Fever can be mild initially, but it goes to high grade. It is associated with lot of chills in the body. There can be associated headache. Later on it can cause confusion, it can cause seizure, there can be yellow discoloration of eyes, there could be dark colored urine and there could be less urine formation also. So malaria can present with fever and there are a lot of causes for fever. So to differentiate that this kind of fever is caused by malaria, we have to do some blood tests. So there are some antigen tests which can tell whether it has malaria antigen. So this is called a rapid malaria antigen test. Besides this, there is a peripheral smear that you make a smear of the blood of the patient and examine the peripheral smear for the presence of Plasmodium into the RBCs. Besides this, to know the complication, one need to do the hemoglobin level, platelet, liver and kidney function test as well. It's a protozoal infection, so you need medications to kill that protozoa. The one revolutionary medicine which came in history and was first used was a quinine, which was actually a derivative of a plant, cinchona tree, and then it was found to be life-saving in so many cases. Now there are more and more drugs available for treatment of malaria like chloroquine and then artemisinin-based salts along with a combination. So because of the emergence of resistance in Plasmodium or malaria cases, now mostly we use is an ACT, that is artemisinin combination therapy. So mostly two drugs are used, but simply putting it, there are a number of medicines which kill the Plasmodium parasite. They are used for treatment of malaria. Obviously supportive and symptomatic treatment is given along with. Treatment needs to be individualized depending upon the age of the person, the kidney function of the patient and also a lot of other factors. But some basic things like chloroquine and artemisinin based treatment is common for most of people. In pregnancy, we cannot use certain medications and also in children less than 12 years of age, some medications are contraindicated. So treatment has to be tailor-made for a person. If a person has a liver or kidney dysfunction, then also some specific medication and their dose needs to be adjusted. For malaria prevention, the most important thing is that preventing mosquito breeding and mosquito biting. For prevention of mosquito breeding, we have to make sure that there is no stagnant water around. So all areas which can be emptied of water should be emptied every 7 days. Where we cannot empty like big ponds and all that, then put some oil which can prevent the larva from developing in the standing water. And for mosquito bite prevention, I think first important thing is wear fully covered clothes, cotton clothes. Then using mosquito nets. Then skin friendly mosquito repellents is also important. If we can prevent mosquito bite, we can prevent malaria. Malaria is one of the leading cause of mortality in developing and underdeveloped countries, and it has taken a huge toll on mankind. So we should do all possible measures to prevent malaria.